Hello, this is Professor James Strickler, and this is a course in American government. This lesson is from Unit 11 about public policy. It's Lesson 13 about entitlement politics. In this lesson, you'll learn about Obamacare, about entitlement problems, about entitlement cliffs, and about immigration and entitlements. In the previous lesson, we talked about how there are certain major entitlement programs, including Social Security, Medicare, Medicaid, various welfare programs, and Obamacare. We then singled one of these out for a closer look. That was Social Security. We first explored how Social Security actually works, how it takes money from healthy young workers through the payroll tax, sends it to the Social Security Trust Fund, and then from there it's distributed through entitled benefits to old and disabled people. We then talked about the problem with Social Security, that the pool of young healthy workers, relatively speaking, is getting smaller as people have fewer and fewer children, while the pool of old and disabled people wanting Social Security is growing bigger and bigger as people live to a longer age. We're now going to look at a second entitlement program, Obamacare, and see how it suffers from the same sorts of problems. Obamacare is a national program that requires everyone to have health insurance. It's named after President Obama, who was the president at the time that Congress enacted Obamacare. This requirement under Obamacare to have health insurance is called the individual mandate, because individuals are mandated, or in other words required by the government, to purchase insurance if they don't already have it through some other means. For those who can't afford to buy the insurance, the government provides subsidies. In other words, government payments to those people in some form to help them afford to get the insurance. After having made sure that everyone is going to go try to buy insurance of one sort or another, or have their employers buy it for them or something, so everyone's trying to get insurance, Obamacare also ensures that the insurance has certain features. Those are, first of all, that a person can't be denied coverage because of some pre-existing condition. So somebody with terminal cancer can walk in and buy insurance and the insurance company can't tell them no. That's something they would have done before, because they would have looked at that person and said, there's no way we'll ever get our money from them. They're a losing proposition, so we aren't going to sell them insurance. But now they have to sell them insurance. Not only do they have to sell sick people insurance, but the rate that they charge them for that insurance is not based upon that person being sick, but it's instead based on the community in which they're selling the insurance in. In other words, they have to charge everybody in that community the same price, regardless of how sick they may be. The third feature of Obamacare is that there's no lifetime maximum. In other words, when you get insurance, there are no limits eventually to how much they may have to pay to keep you alive. Again, go back to the idea of somebody who has terminal cancer who purchases insurance. Maybe over the course of their life it's going to cost them, the insurance company $10 million to provide for them. Oh well, this insurance company still has to sell them that insurance policy at the same price they're selling it to everybody else. So now that you understand the features of Obamacare, let's look at how it works. And you'll notice that the diagram is almost exactly the same as the diagram for Social Security. You have young, healthy people paying into the system, in this case through the individual mandate, instead of through a tax on their paycheck. They're not paying into the Social Security Administration, but they are paying into some agency that's in charge of redistributing these resources, and that's the insurance companies. And then the money goes out to the sick and older people through the fact that they get paid from the insurance companies without being able to be denied, no limits, things like that. So you can see from this diagram that Obamacare isn't so much an insurance system in the idea of people sharing risk. Instead, it's a wealth transfer system. You're going to force young, healthy people who really, for the most part, don't need health insurance. Young, healthy people, pretty much all that happens to them is they sprain their ankles and they get strep throat, things like that. Things that really don't require extreme medical care. But we're going to force them to buy insurance, then we're going to take the money from them buying insurance, and we're going to use it to take care of all those sick old people that are getting older and older all the time and sicker. Now, this isn't just my judgment of how this works. Jonathan Gruber, economist at the Massachusetts Institute of Technology, who is oftentimes described as the architect of Obamacare, the guy who helped the people in government who actually created this law figure out how to create it. He said, if you made explicit that healthy people pay in and sick people get money, it would not have passed. In other words, he said that even though this is what it was really set up to do, they couldn't tell people that at the time they were passing it, otherwise they wouldn't have supported it. And he said that's because of the stupidity of the American voter. Not a very nice thing to say, but at least now he's admitting the truth of the system as it was set up. It is a wealth transfer system. Now, just like with Social Security, this isn't necessarily a bad idea in and of itself. The idea of Social Security is that the young, healthy people pay in to take care of the older people. But then when the younger people grow to be old, then their own children and grandchildren are taking care of them. And this works as long as there are plenty of young, healthy people to take care of the old ones. But just as that becomes a problem for Social Security in the end, it ends up being a problem for Obamacare too. See, people require more health care in order to live longer. That's what's happening as people grow older and older in society. Remember when we talked about Social Security in the previous lesson, we said that the average person only lived to be 63 when Social Security was started. Then by 2010, they were living to be 79. Well, as those people get older, they require more and more health care to sustain them. So not only are they living longer to draw on health care, but the health care they require becomes more and more expensive the entire time. At the same time it's becoming more and more expensive to keep these old people taken care of, they along the way have had fewer and fewer children. So the pool of young healthy people paying into this healthcare system is getting smaller and smaller, while the pool of older and sick people taking money out of the system is getting bigger and bigger. So we can diagram this out also to help us picture it in our minds. Here's the diagram we created of how Obamacare works. Young, healthy people paying in through the individual mandate to the insurance companies, then the insurance companies distributing the benefits to the sicker and older people without being able to deny them coverage or limit how much they're going to get paid. But the number of young, healthy people is getting smaller and smaller, and the pool of sicker and older people is getting bigger and bigger. Well, it's kind of obvious what's going to eventually happen here. The health insurance companies are doomed to insolvency. Now, hopefully you remember what that word means from the previous lesson. It means that they're going to run out of money and go bankrupt, essentially. Well, they're doomed to that unless they continually raise insurance rates on the young and the healthy, or receive some sort of big subsidies from the government. We've actually seen this happen in the first few years that Obamacare has been in place. The insurance rates have continually risen higher. This is something that was probably also understood at the time that Obamacare was created. The politicians sold it by saying it will actually bring health insurance rates down, but most economists understood that that was never going to happen. But it's the way it had to be sold to the public. So while it's set up as a good-hearted system that makes some sense to begin with, it's just not sustainable demographically. As the population shifts and becomes constantly older, with fewer and fewer young people, you're not going to have enough people paying in to keep these insurance companies going, with all that they have to pay out to keep the old people going. So from this example of Obamacare and the previous example of Social Security, we can see some general problems with entitlements. The first is that they're politically unaffordable. We've already talked about the giant national debt and how entitlements are a big reason why the debt is so huge. Because politicians realize they can buy votes with these programs. They can tell people we're providing these things for you, so keep voting for us. But at the same time, people don't really want to pay for them with increased taxes. So the way the politicians get out of that difficulty is they borrow money in order to pay for the programs that they've been promising to get the votes. And as a consequence, the debt just gets bigger and bigger and bigger. The second general problem with entitlements is that they're demographically unsustainable. This means that these entitlements are going out to groups that are getting bigger and bigger all the time, the old and the sick, while at the same time the groups that are paying in for the entitlements, the young and healthy people, relatively speaking, are getting smaller and smaller as people have fewer and fewer children. Another problem with entitlements that we previously discussed, but I want to emphasize now, is that entitlements create dependency. Now, what do I mean by that? I mean that they create dependency by the beneficiaries of the programs coming to rely upon them. So, for example, an older person who's expecting Social Security doesn't put money into their own retirement fund. And as a consequence, when they get old, if you suddenly took their Social Security away, they would have nothing. Or what may happen in the future, people will become dependent on Obamacare, providing insurance for them. Where if Obamacare is ever taken away, they will simply have no health insurance. We've already seen this happen with businesses who previously provide health insurance for their employees, shifting away and not doing it anymore, and relying on those people going to the Obamacare system to buy subsidized insurance instead. So people become dependent upon the system. And the problem with that is the system is unsustainable in the long run. It just costs too much. They're unwilling to pay for it. The debt is getting bigger. The number of people paying in is getting smaller. In the long run, you can't keep this going. But when it eventually falls apart, the people who have become reliant upon it will have nothing left. And chaos will result. A fourth problem with Obamacare is it creates what we can call perverse incentives. Well, what do I mean by that? Perverse incentives are reasons that a person has to behave in some way that actually contradicts accepted standards. So let me explain this with a diagram. This diagram represents what would happen to a single mom as her wages increase. So let me point out the features of this diagram so you can see what they are. First of all, we got a line kind of cutting across the middle of the diagram. That shows this hypothetical woman, single mother's wages rising. As we go from left to right across the diagram, we're saying she makes more and more money. Then below that, we've got these blue columns coming up. They're representing how much of that money that she earns she actually gets to keep in her paycheck. So the reason they're different is because some of the money is lost to taxes. As a matter of fact, as her income gets bigger, she loses more and more money to taxes. That's why these blue columns underneath aren't the same height as that line that goes diagonally across the diagram. So remember, the line is showing what her wages are that she's supposedly getting. Then the blue is showing her income that she actually gets after taxes are taken away. These other multicolored columns that you can see mostly over to the left represent the various government welfare programs that she can get payments from. So while she may be making no income, if you go all the way to the far left of the diagram, there's a whole host of government programs that will give her money to try to sustain her, so that she and her child or children don't starve to death, aren't homeless, things like that. Now let's notice the specifics of this diagram. Where I have the arrow pointing at now shows where her wages would be $29,000. Okay, so that's her salary. She has a job. She's making $29,000. If we now look at how much money she's actually bringing home when we total on all the welfare benefits she would also get, she's actually bringing home $57,000 between the money she earned at her job and the welfare benefits that she's given. She is ending up with a fairly sizable amount of money to take care of herself and her children. Now, what happens if we move her income up to $44,000? You'll notice that at $44,000, some of these welfare benefits that she had have dropped away. They only go up to a certain wage point and then you don't get them anymore. The idea is that when you're poor, you really need these things, but as you make more money, you won't need them anymore. So when she gets up to the point of making $44,000, she actually loses a bunch of that in taxes. She only gets a little bit of it in continued welfare benefits. So she ends up taking home $42,000. I hope you notice what's happening here. I'll be explicit about it in just a moment. So let's take another example. Let's say she's making $69,000. Now you notice that there's a big gap between the line of what she's making, what she actually gets to take home in income, because she has to pay a bunch of taxes on that money. She ends up taking home only $57,405 out of that $69,000 that she made. And she gets no welfare benefits. So now let's ask a couple questions. If the single mom, who's earning $29,000 a year in wages, actually brings home about $57,000 in everything, including her wages and her benefits, and is then offered a job earning $42,000 but will only bring home $44,000, should she take the job? In other words, we're offering her a $15,000 raise. Should she take it? If she's rational, she shouldn't, because she'll actually make more money with the lesser paying job and getting all the welfare benefits. Let's actually take it more extreme. Let's say we have this woman making $29,000 and she's offered a job that'll make $68,000, more than twice as much as she's making. Well, when she's on the $29,000 job, she'll be making a little over $57,000 a year when you add in her welfare benefits too. But if she takes the $68,000 a year job, by the time we take her taxes away, she'll actually be making less than $57,000. So again, rationally speaking, what should she do? Should she take the job that more than doubles her income? No, she shouldn't. She makes more money by sticking with the lesser job. This is why entitlement cliffs are a problem. The entitlement cliffs are income levels where earning more money results in actually having less money, because whatever benefits were there now end because you're making too much money. You don't get them anymore. So these entitlement cliffs then create these perverse incentives that I was mentioning. The perverse incentive is this point at which the person rationally chooses to stay on welfare, because they would get less money by taking a better job and getting off of welfare. Okay, so with all these problems, is there any way to rescue our entitlement system? It creates dependency and perverse incentives, and it's economically unsustainable in the long run, and it creates all these political problems. All right, is there anything to do about this to sort of rescue these things? The voters aren't going to want to get rid of these entitlements, but we're going to run out of money at some point, and they're going to collapse and go bankrupt anyway. Can we save them? Well, there's no coincidence that the same politicians who are most supportive of entitlements are also the politicians who are most supportive of open immigration. Now, why would that be? Let's go back to our diagram and we can explain it. All right, so remember that we had a diagram of how Social Security works and how Obamacare works. Now we're just going to have a general diagram of how entitlements work. Entitlements generally always follow the same pattern. You got young, healthy, working people who then is in some way required to pay into some agency, whether it's a Social Security trust fund or insurance company or whatever it is. And then that agency then somehow distributes these monies out to older and sick people. Entitlement programs are redistribution from young, healthy people to older, sick people. And they all face the same basic problem, that we're ending up with, relatively speaking, fewer and fewer young, healthy people paying in and more older and sick people taking money out. So to rescue this system, what we really need is a whole bunch more young, healthy people paying in. Now, we probably aren't going to be able to force people to start having 7 or 8 or 9 or 10 kids. That's not going to work. So where are we going to get these extra young and healthy working people from? That's where open immigration comes in. If you get a bunch of young, healthy workers to come in from Mexico and take jobs, then they can start paying into the entitlement system. And that extra money will then provide what's necessary to pay for all the old sick people. But even this immigration solution is only a temporary solution. It just kicks the can down the road, as we've talked about before. Why is that? Because those immigrants that come into the country to help contribute to the system, eventually they're all going to grow old too. And they're going to start taking money out. And along the way, just like the people already here in the United States of America, they will have relatively fewer children also. So we're just going to end up with the same problem in the end. All we've done is perhaps put it off for a couple of decades by bringing these immigrants in. It does not really fix the problem. It only temporarily puts off the day of reckoning when eventually this system is doomed to all fall apart, unless we can make the really tough political choices to reform it, to fix it, to cut benefits, to somehow get more money coming into it. All right, let's review what we learned in this lesson. First of all, what does Obamacare do? Is it something that requires health insurance? Does it provide free health insurance? Does it supply more doctors? Or does it end private insurance? Obamacare requires people to have health insurance. That's what it does. How do entitlements create dependency? Is it because interest groups oppose them? Is it because politicians try to remove the entitlements? Is it because people are ordered to take the entitlements? Or is it because people come to rely upon those entitlements? Entitlements create dependency because people come to rely on them. They get used to having them and don't plan for otherwise not having them. What is an entitlement cliff? Is a date when benefits increase? Is it when more wages get less total money? Is it politicians voting against them? Or is it the recipients refusing to take the entitlements? An entitlement cliff is when making more wages actually gets a person less money because the benefits end. Oops, you earn too much, you don't get your check anymore. How may immigration impact entitlements? Is it that the immigrants will support entitlement repeal? Is that the immigrants provide more young workers for the system? Is it that the need for benefits will decrease as we have more immigrants? Or is it that the immigrants actually won't have any impact on the system? Having immigration will theoretically provide more young workers for the system and sustain the system a little bit longer. But again, that only puts off the day at which it'll run out of money. It doesn't actually fix the problem of it running out of money. All right, that completes this lesson. The next lesson will also be from Unit 11. It'll be Lesson 14 about foreign policy.